Today we're going to talk about the early symptoms and, in general, the symptoms of various types of cancer. I think many of you believe that it's weight loss, exclusively bad blood tests, a sudden aversion to meat, or suddenly enlarged lymph nodes in your neck or somewhere else on your body that are the symptoms of cancer. However, that's far from always the case, so by watching this video to the end, you'll definitely learn about the real symptoms. And I think your fears and concerns will diminish because forewarned is forearmed. Just as there's no definitive blood test that indicates the presence of a cancerous tumor, there's also no single symptom that reveals all malignant growths. They vary tremendously from one another. And what's most important is that the very first symptoms appearing in absolutely all types of cancer already indicate not an early stage of the disease. If we're talking about breast cancer, for instance, no one can feel, find, or palpate a tumor smaller than about a quarter inch. Therefore, the earliest possible detection of malignant growths always involves diagnostic procedures, always requires visiting doctors, and always requires getting examined. Let's go through the most common types of cancer among men and women according to statistics and examine the signs of the presence or absence of each disease. Skin cancer is a condition that occurs fairly frequently among both men and women, and the main cause of this disease is ultraviolet radiation. A shout out to all you sun worshippers who love getting tanned to a deep bronze color. The insidious nature of this condition is that while hands, legs, and face are visible parts of the body, skin cancer and melanoma can be located in rather unusual places. There are even cases of melanoma on the heel. First and foremost, pay attention to whether there's a growth present, whether it's pigmented or non-pigmented. We look closely at the borders. Benign growths typically have clearly defined borders. Malignant growths have fuzzy, irregular borders. Next is the uniformity of color if it's a pigmented growth. Benign growths are usually uniformly colored, while malignant growths have uneven coloring. If you notice that you had one small mole and after some time there are now 3 in its place, that's also a warning sign. The appearance of ulceration on the growth is another concern. A very common trap that patients fall into is saying that this mole has been with them since birth, that it's always been there, and there's nothing scary about it. But you always need to understand that even if a growth has always been there, periodic exposure to ultraviolet radiation can cause changes even within a birthmark on the skin. So pay very close attention to any changes, size, color, borders, in order to make sure that, on one hand, monitoring skin growths is done properly, and on the other hand, you don't fall into the realm of paranoia. I recommend that if you have many pigmented growths on your skin, you should definitely show them to a specialist at least once a year who can, using a special examination called dermoscopy, first of all document the growth. This means if you come in the following year, you'll already have photos of how it looked a year ago. So you're not just tracking changes by eye, but you have clear documentation for assessing the dynamics of skin growths. And one more very important fact I'd like to convey to you: skin melanoma and skin cancer have the lowest occurrence rates in regions where there's minimal sun exposure or in places where people wear covered clothing for cultural reasons. In these cases, the probability of developing malignant skin growths drops dramatically. The next malignant growth we'll discuss is breast cancer. Here, absolutely all women are in the risk group, but there are symptoms that should raise concern. They're generally well known: the presence of a lump in the breast, the appearance of new growths, nipple discharge, ulceration on the nipple, skin quality, the presence of what's called orange peel texture, and whether there are abnormal lymph nodes in the armpit. Again, I emphasize that these are symptoms of the presence of a malignant breast tumor. These are not early symptoms. If there's orange peel texture, it means the disease has already progressed quite far. If there are enlarged lymph nodes in the armpit, it likely means there's already metastatic spread. Therefore, the earliest sign of a malignant growth is a lump, a small pea-sized mass that a person can feel on their own. And again, small growths cannot be felt, which is why regular monitoring, performing ultrasounds and mammograms is critically important for tracking breast health. Only this way can breast cancer be detected at the earliest stage. Next, we move on to malignant growths that are located inside our body. Accordingly, these growths cannot be discovered at an early stage without undergoing examination. Lung cancer. Lung cancer clearly has an absolute association with smoking. In smokers, lung cancer occurs many times more frequently than in non-smokers. Of course, you'll write in the comments that someone you know smoked, drank, did everything possible, and still lived to be 100. Let's not even get into that. Smoking equals lung cancer. If a person has this factor of smoking in their life, the probability of developing lung cancer by the end of their days is colossal. Of course, lung cancer can occur in non-smokers too, but far less frequently than in smokers. The first signs of a problem in the lungs is a cough, that very smoker's cough that develops in long-term smokers. In some cases, blood may appear in the phlegm that the person coughs up. This is a warning sign. It may indicate that the tumor has grown large enough to spread from the lung tissue into the bronchus, where some of the cancer cells are dying off and blood is mixing into the phlegm. Chest pain is another symptom. As you can understand, for something to start hurting in the lung, it must already be of a size where it's grown enough to press on nerves, and then the person begins to feel chest pain. Shortness of breath is another symptom, though far from an early one. Shortness of breath occurs when lung tissue becomes so diminished that it can no longer adequately supply our body with oxygen, or when fluid accumulates in the pleural spaces, the cavities where our lungs work, due to metastatic spread. These are also advanced stages. So we're really talking here not about early symptoms of lung cancer, but about symptoms of lung cancer that has already progressed significantly. There's one interesting fact. When the coronavirus pandemic began, the detection of early-stage lung cancer increased dramatically. This was because the CT scans performed on a huge number of people during the virus epidemic identified a group of people who had asymptomatic lung cancers that were still small, and this saved many thousands of lives. So there's no absolute evil or absolute good. Everything has a dark and light side. And of course, lung cancer occurs more often in men than in women. This is again related to smoking frequency. Among men, it's higher than among women, which is exactly why lung cancer is higher in male patients. The next cancer that's also very hard to detect at an early stage is stomach cancer. This disease is characteristic mainly of men, which again is connected to harmful habits, because among people who abuse alcohol, smoking, and spicy or raw food, the probability of developing stomach cancer is higher than in other people. It's also worth emphasizing that any food that's aggressive to the stomach, very hot tea like boiling water, or extremely spicy food, increases risk. Why is the frequency of stomach cancer development higher in the southwestern states compared to northern states? This is related to dietary habits. That's why, for example, South Korea is one of the few countries where there's a government-sponsored screening program that performs endoscopy on the entire population. That's why the detection rate of stomach cancer at the very earliest stages is highest in South Korea, but terminal stages of stomach cancer are practically never seen there. So there are certain factors that provoke the development of stomach cancer besides thermal and chemical irritants. It's very important to mention the H. pylori bacterium, which is present in almost the entire population. This very bacterium can locally cause destruction of the stomach lining, and accordingly, inflammation develops there. and any chronic inflammation inevitably leads to mutations and accumulation of mutations, which is malignant growth. Additionally, for stomach cancer, there's a family predisposition. If someone has relatives who had stomach cancer, the probability of it occurring in subsequent generations is 2-3 times higher than in the comparison group. So what symptoms might indicate a malignant growth in the stomach? The symptoms here are diverse, ranging from heartburn, starting with belching and hiccups, and ending with vomiting blood, depending on the spread of the disease. For stomach cancer, the symptom of weight loss is very characteristic. If, over a short period of time, a person rapidly loses several pounds, it's a very concerning sign. It means there are problems with the intake of nutrients into the body. This may be related to problems in the stomach, including malignant growth. Therefore, if you have this concerning symptom, you should definitely see a doctor to rule out this condition. And again, virtually all these symptoms are characteristic not of a growth just a fraction of an inch in size, but rather of a tumor several inches in size that will already be pressing on nerve plexuses. Then there will be hiccups, difficulty swallowing food through the area where the stomach connects to the esophagus. All of these are advanced stages of the disease. Therefore, early symptoms of stomach cancer, just like lung cancer, do not exist. Colorectal cancer, or cancer of the colon, occurs in the middle-aged patient group, from age 50. Early symptoms of colorectal cancer do not exist. There are signs characteristic of the presence of a malignant growth. First, pain in the lower abdomen, pain during bowel movements, the presence of blood in stool, and importantly, this blood in small amounts will be unnoticeable. Only when the stool becomes actually dark in color does this indicate there's gastrointestinal bleeding or there's a lesion in the intestine that's bleeding. And accordingly, we'll already see a large amount of blood in the stool, which again won't be an early symptom. Here it's also important to note that the nature of the blood will be quite specific. If there's fresh blood in the stool, it doesn't necessarily mean there's cancer in the colon. More likely, it indicates the presence of hemorrhoids in the rectum, but dark stool, when it's actually black in color, indicates there's a problem in the upper sections of the intestine that's bleeding, and when this blood passes through the gastrointestinal tract, it gets digested, and a characteristic black pigment remains. That's very important to pay attention to. Risk factors here again include smoking, alcohol, and consumption of large amounts of red meat, which has been statistically proven to increase the development of colon cancer. Also, consumption of processed meats, sausages with long shelf life that contain huge amounts of preservatives, especially sausages made of actual meat, not those sausages that contain nothing but soy. Those are actually the healthiest sausages, the ones without meat. For colon cancer, there's a relatively early diagnostic method called the fecal occult blood test. This test can indirectly confirm or rule out the presence of a malignant growth in the intestine. Prostate cancer. For prostate cancer, the typical age is from 55 years old. This is a relatively indolent cancer. Even the malignant cells that develop in the prostate are usually low grade. Second, they respond well to therapeutic treatments. And third, for prostate cancer, there's a blood test that allows detecting it at early stages. It's called PSA, prostate-specific antigen, which you can have tested to understand your prostate health status. Early signs of a growth are heavily masked by another benign condition that causes frequent urination, causes unpleasant sensations during urination, ejaculation, and so on. All these symptoms should alert you and definitely send you directly to a specialist who deals with this organ, a urologist. It should also be noted that one of the symptoms of prostate cancer is blood in the urine, which also indicates that a tumor is developing to such an extent that in the urinary tract there's an area that's starting to bleed. However, the presence of blood in urine doesn't necessarily indicate the presence of a malignant growth in the prostate. It could also be bladder cancer, which incidentally is also strongly dependent on smoking. So notice how many types of cancer we've listed today, where the main factor that increases the development of these growths is smoking. If we look at cancers of the blood-forming system, hematological cancers, what people commonly call blood cancer, characteristic symptoms include changes in facial color because as the malignant cells divide, they begin to suppress natural blood formation, so hemoglobin starts to decrease and pallor of the skin develops. One of the symptoms of hematological malignancies is enlargement of lymph nodes. And this enlargement will occur throughout the body, in the neck, groin, armpits, and other lymph nodes accessible for observation. A relatively accessible diagnostic method for hematological conditions is a blood test showing changes in lymphocytes and leukocytes. This lineage will increase, and if you get an expanded test showing what classes of lymphocytes are present, you can get more information, and the red blood cell lineage will be suppressed. Accordingly, we'll see a decrease in red blood cells and a decrease in hemoglobin. Gynecological cancers. These include cervical cancer, ovarian cancer, and uterine cancer. Clearly, mainly women are at risk here. In the risk group are women who test positive for human papillomavirus. Early symptoms include contact bleeding, bleeding after intercourse, pain in the lower abdomen, a feeling of fullness in the lower abdomen, and non-specific symptoms. Again, weight loss, feeling of weakness, decreased hemoglobin, and abdominal enlargement, which can also indicate advanced stages. When the abdomen enlarges here, it's not just the growing tumor causing it, but accumulating fluid that forms after cancer cells affect the peritoneum, the inner lining of the abdomen. A relatively early laboratory test that helps diagnose gynecological cancer is the CA-125 tumor marker test, which is elevated in women with malignant growths. Brain cancer deserves separate mention. This is a relatively rare cancer overall. Primary brain tumors, which form directly in the brain, are generally very rare. Most often, the brain serves as a target for metastases from various tumors that spread hematogenously through the bloodstream. These include lung cancer, intestinal cancer, breast cancer, and prostate cancer. All these tumors are capable at a certain stage of metastasizing to the brain, but primary brain cancer is rare. Naturally, there's not much space in the brain, so this is precisely the cancer that can be discovered at an early stage. Even small growths of a couple of inches change the architecture of the brain. They alter the positioning of various areas. And depending on which area of the brain the growth is located, different symptoms will appear. If in the occipital cortex, there will be visual disturbances, floaters, double vision. If in the central parts, gait disturbances, our cerebellum controls balance, equilibrium, the ability to sit properly. There may be personality changes if the tumor is located in the frontal lobes, memory impairment if in the temporal lobes. All these symptoms characteristic of brain cancer can, unlike the internal cancers mentioned earlier, be discovered at relatively early stages. So to summarize, first, I think you've understood that the opportunity to find a malignant growth at an early stage only exists if we go to a clinic for examination. So what examinations need to be done? First, ultrasound and mammography for women annually. Second, chest X-ray or CT once a year for people who smoke, who have a high smoker's index. If you have many pack years, you can look up what that means. In this case, it may be possible to perform examinations every 6 months in this category of patients. Digital rectal examination, fecal occult blood test. For men over 55, prostate ultrasound is mandatory, fecal occult blood test is mandatory, and PSA test is mandatory. For women, definitely an annual gynecological exam and pelvic ultrasound. If you have any complaints related to the gastrointestinal tract, you should definitely see a general practitioner and, if necessary, undergo endoscopic examinations to find suspicious areas. Stomach cancer is very, very common, so don't ignore symptoms. For people who have pigmented growths, who have skin growths, annual examination by a dermatologist or oncologist who will track the dynamics of these growths. And naturally, don't smoke, minimal alcohol, and don't sunbathe. All these criteria will help you live longer. Be sure to find time for yourselves. Dedicate it to yourself, not just to lie down and relax, but to get complete information about your health. Stay healthy. Goodbye.